Mansearch for Meaning, page 125. Such a procedure, however, must make use of the specifically human capacity for self-detachment inherent in a sense of humor. This basic capacity to detach oneself from is actualized whenever the logotherapeutic technique called paradoxical intention is applied. At the same time, the patient is able to put himself at a distance from his own neurosis. A statement consistent with this is found in Gordon W. Allport's book, The Individual and His Religion. The neurotic who learns to laugh at himself may be on the way to self-management, perhaps to cure. Paradoxical intention is the empirical validation of the clinical application of Allport's statement. A few more case reports may serve to clarify this method further. The following patient was a bookkeeper who had been treated by many doctors and in several clinics without therapeutic success. When he was admitted to my hospital department, he was in extreme despair, confessing that he was close to suicide. For some years, he had suffered from a writer's cramp, which had recently become so severe that he was in danger of losing his job. Therefore, only immediate short-term therapy could alleviate the situation. In starting treatment, Dr. Eva Kostera recommended to the patient that he do just the opposite of what he usually had done. Namely, instead of trying to write as neatly and legible as possible, to write the worst possible scrawl. He was advised to say to himself, "Now I will show people what a good scribbler I am." And at that moment, in which he deliberately tried to scribble, he was unable to do so. "I tried to scrawl, but simply could not do it," he said the next day. Within 48 hours, the patient was, in this way, freed from his writer's cramp and remained free for the observation period after he had been treated. He's a happy man again and fully able to work. A similar case, dealing, however, with speaking rather than writing, was related to me by a colleague in the laryngological department of the Vienna Polyclinic Hospital. It was the most severe case of stuttering he had come across in his many years of practice. Never in his life, as far as the stutterer could remember, had he been freed from his speech trouble, even for a moment, except once. This happened when he was 12 years old and had booked a ride on a streetcar. When caught by the conductor, he thought that the only way to escape would be to elicit his sympathy, and so he tried to demonstrate that he was just a poor stuttering boy. At that moment, when he tried to stutter, he was unable to do it. Without meaning to, he had practiced paradoxical intention, though not for therapeutic purposes. However, this presentation should not leave the impression that paradoxical intention is effective only in monosymptomatic cases. By means of this logotherapeutic technique, my staff at the Vienna Polyclinic Hospital has succeeded in bringing relief even in obsessive compulsive neurosis of a most severe degree and duration. I refer, for instance, to a woman 65 years of age who had suffered for 60 years from a washing compulsion. Dr. Eva Kostera started logotherapeutic treatment by means of paradoxical intention. And 2 months later, the patient was able to lead a normal life. Before admission to the neurological department of the Vienna Polyclinic Hospital, she had confessed, "Life was hell for me." Handicapped by a compulsion and bacteriophobic obsession, she finally remained in bed all day, unable to do any housework. It would not be accurate to say that she is now completely free from symptoms, for an obsession may come to her mind. However, she's able to joke about it, as she says, in short, to apply paradoxical intention. Paradoxical intention can also be applied in cases of sleep disturbance. The fear of sleeplessness results in a hyperintention to fall asleep, which in turn incapacitates the patient to do so. To overcome this particular fear, I usually advise the patient not to try to sleep, but rather to try just to do the opposite. That is, to stay awake as long as possible. In other words, the hyperintention to fall asleep arising from the anticipatory anxiety of not being able to do so must be replaced by the paradoxical intention not to fall asleep, which soon will be followed by sleep. Paradoxical intention is no panacea, yet it lends itself as a useful tool in treating obsessive compulsive and phobic conditions, especially in cases with underlying anticipatory anxiety. Moreover, it is a short-term therapeutic device. However, one should not conclude that such a short-term therapeutic necessarily results in only temporary therapeutic effects. One of the more common illusions of Freudian orthodoxy, to quote the late Emil A. Guthel, is that the durability of results corresponds to the length of therapy. In my files, there is, for instance, the case report of a patient to whom paradoxical intention was administered more than 20 years ago. The therapeutic effect proved to be, nevertheless, a permanent one.